Hey, it's Nina Lemtier here, the nutrition lifestyle strategist. Happy Sunday. How are you? I hope you are all well. I'm going live just to drop bust some myths, some hormone myths linked to fibroids. So let me know where you're joining, and if you've got any questions, I would love to try and answer them. Hi, Donna. Lima as well. Thanks for joining. Let me know where you're joining from. So before I get started with the myths, for those of you that don't know me, my name is Nina Lemtier and I'm a nutrition lifestyle strategist. I help women globally to not only empower their wombs, but also understand their body's natural healing capabilities when it comes to navigating fibroids. Particularly, I do help women that suffer with endometriosis, adenomyosis, cysts. Actually, one of my clients, Yolande, dissolved one of her cysts on my workshop, which was amazing. Oh, West Midlands. Oh, lovely. Nice. Thanks for joining. I'm actually in the Midlands as well. Lovely. And yes, so that's what I do. And I'm very passionate, about women just having more options. It's not about, saying that there's no place for medicine. Of course, we're obviously fortunate if you're in the UK to have the NHS. However, it's not, it's not relying on surgeries, right? It's about having more options so that you're not having to do surgeries every year or whatever. And then taking strong medication that not only has side effects but can compromise your fertility, obviously, if you want to conceive one day. So yes, that's really what I do. And I help women in other, off Facebook. So we've got the community, the Womb Care Network, and we've got the Nourish Her app, which is, I'm getting amazing feedback from ladies that are using that now. So we're really having fun. So the 3 myths, right? So the first myth is that if your periods are regular, your hormones are balanced. Now that's a myth. You can have regular periods and still have hormonal issues in the background that potentially could be that you may not have been diagnosed with, or you may be diagnosed with them. And it's really just understanding the environment more than anything, rather than focusing just on the fibroids. Particularly if they're in growth, like you're going for scans and they just keep growing. Okay, so that's myth number 1. The second myth is that hormonal issues typically come during menopause. You can suffer with hormonal issues in our 20s, 30s. It's not just gonna happen in menopause, right? So if you're suffering with repetitive issues like infections, particularly like yeast infections, and it's very repetitive, you're having to have antibiotics quite regularly, and you're also maybe having other symptoms like fatigue and mood, you're quite moody, and then you might even have hair, right? Growing facial hair, or hair growing in places where it wasn't growing before. And also skin issues, if you're having skin issues. So all these indicate that you want to do some further investigations. And then the third myth is that stress doesn't affect fibroids. So you have chronic stress. So we all have gone through stuff, right? And you can have stress that you may not have kind of managed, or you're compressing, you're not talking about it, and it's just bubbling down there, right? And this is affecting you. So it's really just about identifying what you may have experienced or what could be really affecting you that you're not addressing. And this can pop up in different forms. So there are lots of studies that show the impact of stress and unresolved trauma. That's what the term I was looking for. And then you've got obviously current stresses, right? So where you can actually say my work, for example, is stressing me. Maybe there's stuff happening at work, relationships, things like that. But you just identify the stresses in your life. And obviously it's about navigating them and not feeling like you can just ignore them, hope that they will go away, because they do affect us. And we tend to internalize it, and then it manifests into physical diagnosis of all sorts. Okay, so for me personally, my fibroids were growing the most rapidest, if that's a word, the fastest, when I was stressed. So I was addicted to junk food, and I was probably the most stressed of my life. And that's where they grew the most. And often when I speak to women, they can always kind of think of a stressful time, like that's where they were either diagnosed or they noticed growth, right? So there's definitely a correlation there. Hi, Shu, Smith, Halim, Seti, Ratilia, B. Thanks for joining. If you've got any questions, feel free to ask. Let me know where you're joining from. Is that Elizabeth that's in the network? Just wondering if it's you. Because you shared on one of my posts that you've noticed your fibroids are shrinking, which is amazing. And yeah, fibroids do shrink. So another myth is that fibroids can't shrink, but they do shrink. Obviously, variations will be different for women. Everybody's different, but from my experience personally and with my clients, fibroids do shrink. They do. And you can heal. You can support your body naturally, as well as having medical guidance as well. I think yesterday, well, it wasn't yesterday, it was a few days ago, the research shows that when you're having a myomectomy to remove fibroids, particularly if they're submucosal, so the ones that are inside the womb, the research shows that it can cause actually more complications than the concept that it's gonna be easier to conceive or whatever. So the research shows that actually women that have fibroids, most women that have fibroids are having safe pregnancies. So there is a lot we can do to help ourselves to minimize surgical intervention where possible. So she's asking, hi, when your ovaries move near to your bowels and you have endo, how serious can this be and what treatments are successful? Okay, when your ovaries move near to your bowel and you have endo. So have you had a surgery, Shu, before? I'm just curious to know. Typically ovaries moving, so let's say you've never had any surgery and you've been told that your ovaries have moved, that ovaries can move, right? And it doesn't actually mean it will be detrimental. If there is scar tissue, if you've had a surgery, then this would complicate, right? The potential complications. You had a laparoscopy to laser cut the cyst. Okay, laparoscopy isn't, that's minimal, isn't it? It's not necessarily serious. I think it's really just about you being proactive with implementing various reducing risk factors for you. So definitely looking at holistic approaches to control the endo, right? I don't know what stage you're at or what stage the endo is, but that would be something that you should definitely do. And look at your personal risk factors. I do that with my clients, and if you want more information on that, I can definitely share that with you. So that's what I would suggest, but it doesn't necessarily mean it's serious and you haven't had like major surgery. It was quite minimal. So yeah, that's what I would say. And in regards to treatments being successful, what are you referring to? Are you referring to moving your ovaries back to their right position, or endo being removed? What treatments are you? Okay, stage 4. Okay, yeah. What I would say is definitely do a deeper assessment of how you can support your body to kind of control things, right? And I don't know what symptoms you're having, but I offer that. So I do offer free clarity sessions as well. So just drop me a message. But I definitely need more information. But you should explore how to support your body holistically. And in regards to treatments, you would have to obviously deal with each in isolation, if that makes sense. I don't know if that makes sense, but yeah. But let's talk. You want to avoid another surgical procedure to focus. Okay, yeah. Let's talk. And I think depending on what your goals are, maybe, I don't know what fertility's like, what the next 2 years kind of looks for you. But we could definitely discuss more. And you're taking hormone balance pill, which is helping. Okay, that's good. And that's good. You've noticed an alleviation there. But there's lots you can do to get more structured and holistically, right? And the Nourish Her app as well can give you a personalized approach as well, if you wanted something that would give you really good structure day to day. All right, thanks for your question and sharing. Hi, Pauline. Okay. So really it's about, I'm doing a challenge. Gosh, I nearly forgot. I'm doing a challenge. We start on the 11th of this month, and it's all about balancing hormones naturally. So, and just send me a message and I can send you a link, right? It's free. So just send me a message and I'll get you access. And that, I think you would benefit from that, because that will give you, an understanding of what you can do to significantly make progress. One of my clients, Rabia, she had, in 6 weeks of implementing, she's completely addressed pain that she was suffering with, bloating, and all these horrid symptoms that she was really struggling with. And it's all naturally. So yeah, let me know if you want to join that. Send me a message and I'll send you access to that. All right. Well, so those were the myths. I'll quickly run through them for the ones that may have joined, the ladies that have joined later. So the first one is periods being regular. So if your periods are regular, that means your hormones are fine. That's a myth. You can have hormones that are totally not in sync and there's lots of issues and have regular periods. So that's the first myth. And the second myth is you only have hormonal issues when you're going into menopause. You potentially have hormonal issues in your 20s, 30s. So it's not just when you're going into menopause. And then stress doesn't affect fibroids. Stress does affect fibroids because stress ravages hormones. Stress can literally stop your digestive system from working properly. It can just shut your body down in a sense, essentially. So stress is one to be mindful of. And I just identified chronic kind of background stress. So more kind of trauma, right? So trauma that you might have experienced that you haven't really addressed, that you're just pushing, compressing down, that will get you, right? Very, very slowly. And then you've got kind of current stresses, job, relationships. So it's just about being aware and having a strategy in place, because it definitely does impact our hormones. Indirectly will affect fibroid growth and fibroids and other wound conditions as well, right? So I hope you got some value from that. And if you want to join my Hormone Harmony Challenge starting on the 11th of this month, just send me a message, challenge, and I'll send you a way to get access to that for free. and we're going to balance our bodies, get more in sync, get more connected, and just be more intentional about how we can support our hormones, and also not get caught up in just what people kind of say about hormones. It's about understanding actually how you can address your hormones day to day and support their balance. All right, well, thank you for joining. Have a lovely evening. Thanks for your questions, and keep going. You are worth it. You can do it. Everything counts. And don't overlook what you're doing. Even the little stuff, it all adds up. All right, take care. Bye for now. Oh.